Hello, I'm Dr. Sunil Kini, Consultant Joint Replacement and Arthroscopy Surgeon at Manipal Hospitals, Bangalore. To start with, there are four important ligaments in the knee joint. One in the front and back, which we call as the anterior cruciate ligament or ACL. One in the behind is called the posterior cruciate ligament or the PCL. There are also side supporting ligaments on either side of the knee. The one on the inside is called the medial collateral ligament or the MCL, and the one on the outside of the knee is called the lateral collateral ligament or the LCL. So the physiotherapy for various kinds of these ligament injury and post-surgery is slightly different. So I'd like to mention about the more common injury in about 80 to 90% of the cases, which is the ACL or the anterior cruciate ligament injury. So once the surgery is done, it's important to start with the physiotherapy as soon as possible. The physiotherapy after an ACL surgery continues for up to 9 months after surgery, at the point of time at which the patient can start sporting activities also. So knee ligament ACL surgery, immediately after surgery, the patient has to be on a brace, what we call. For the first 2 weeks, it's going to be a straight knee brace. And after that, after stitch removal, for the next 4 weeks, we usually put the patient on what we call as the hinged knee brace, in which the patient can actually bend the knee by himself or herself. The other exercises which we strengthen upon immediately the day after surgery is the static quadriceps exercises, or also what we call as the thigh squeezed exercises. We also start about heel slides, the hamstring exercises, assisted or passive knee bending and knee straightening exercises as well. Immediately after surgery, the patient is expected to have some amount of pain and will be using a crutch or a walking stick, say for about the first week, after which it can be slowly discarded. During the second and third week, it's also important to continue with the physio. The initial goals of physio is to get back the knee range of motion, and secondly is to reduce the pain and swelling, and also the thirdly is to strengthen the muscles around the knee. After the first couple of weeks, we start the patient, as I previously said, on a hinged knee brace in which the patient can bend himself. So after 6 weeks, usually the brace is discarded. The other set of exercises, which is the open chain exercises, are next started, in which a patient is encouraged to do a stationary bike as well at the end of 6 weeks, which continues up to 3 months. So there's various sets of exercises which we divide as the first 2 weeks after surgery, 2 to 6 weeks, at 3 months, 6 months and 9 months. So at the end of 9 months, the patient would have a pain-free range of motion in the joint, as well as the strength needed to carry on with the sporting activities as well. It's also important to emphasize here that after an ACL reconstruction in which we put a new ligament into the knee joint, the first 6 weeks to 3 months is the time limit at which the graft which we put in is at its weakest. So after 3 months, the graft has attained a reasonable amount of strength, after which certain exercises can be or certain activities can be carried on.
Hola Ángela, ¿podrías explicarnos la técnica que estás aplicando sobre esta paciente?
Se llama diatermia. Es un calor profundo y penetra bastante a nivel celular.
¿Y qué beneficios tiene en el tratamiento?
Pues a nivel antiinflamatorio actúa aliviando la inflamación, el dolor, y va bastante bien.
¿Y acelera los beneficios de un tratamiento convencional? O sea, ayuda a que la recuperación sea más rápida.
Sí, la verdad es que está ayudando bastante. Por ejemplo, ella en 10 sesiones ha mejorado una barbaridad.
¿Y se ha hecho esto como prueba complementaria? Es decir, ¿se le hace otro tratamiento?
No.
¿O con esto sobra?
No, únicamente este tratamiento.
Pero además la máquina de diatermia tiene otras funcionalidades, ¿no? Tiene dos cabezales.
Sí, tiene dos cabezales, uno capacitivo y el otro resistivo. El capacitivo actúa a nivel más muscular y el resistivo actúa más profundo a nivel ligamento, tendones. Acelera el metabolismo de las células aliviando la inflamación.
Muy bien, muchas gracias, Ángela.
Gracias a ti.
Haiti after the earthquake, Libya during the revolution, and at the moment in the Central African Republic where a violent conflict is raging. In settings such as these, where medical teams provide emergency treatment, the physiotherapist plays a vital role. Present in operating theatres, on wards and in outpatient departments, sometimes working in cooperation with other NGOs, the physiotherapist delivers the care patients need to help them regain the best quality of life possible.
Le kiné intervient tout de suite après l'opération.
Physiotherapy starts immediately after an operation to avoid patients developing disabling conditions that can occur very quickly if nothing is done. So we try to prevent stiffening of the knees and ankles and muscle wasting to get patients back on their feet as soon as possible and shorten the time they have to spend in hospital.
Limiter la durée d'hospitalisation.
Cet os-là, il est un petit peu comme ça.
At the General Hospital in Bangui, many patients have bullet or knife wounds. Day in, day out, physiotherapy sessions help them to recover. Tahir has 15 machete wounds. He's already spent several weeks in hospital, but his condition continues to give cause for concern. Today is the first time he manages a few steps beyond his room. In Central African Republic, as is often the case in emergency settings, the physiotherapists don't need sophisticated equipment. Just some simple movements can help stave off complications.
Souvent, en urgence, on a des difficultés.
In emergency settings, once patients are discharged, we often have difficulty in getting them to do physiotherapy, as they don't always live in the region and have a long way to come. In these cases, the physiotherapist must focus on accompanying the patient and the people around him to make sure that when he's discharged, he understands why he has to keep up with the exercises.
Because treating patients also means making sure that when they leave hospital, they'll be able to go back to their lives and jobs and look after their families. In countries where infrastructure has been wiped out, part of the doctor's work is helping wounded people regain their independence.